Hey, future nurse, have you ever been stuck on an NCLEX question and have to ask yourself, is this a medication I have to give on an empty stomach or not? Well, this is my little cheat sheet for you. Majority of medications you have to give with food because of GI upset, things like metformin, that's very commonly tested. However, there are certain medications you have to give on an empty stomach, and it's easier to remember those on an empty stomach versus those that you have to give with food. Now, these are the top 4 medications that you have to know are given on an empty stomach for the NCLEX. And I put together a little way that I remember. So before light, we're going to think of B and L. We have our biphosphonates, which is our alendronates, things that are given for osteoporosis, and our levothyroxine. These 2 medications absolutely have to be given first thing in the morning, 30 to 60 minutes before breakfast. Now, the other 2 commonly tested medications are given for reflux, and I separate them from biphosphonates and levothyroxine because these 2 medications can be given before meals. It doesn't necessarily have to be the first thing in the morning. Sometimes it's preferred first thing, but it can be before dinner, at night, etc., and so on. So how do I remember these? Reflux-prone clients, pre-snacks. So remember the P and the S. The P is for PPIs like omeprazole, pantoprazole, lansoprazole, and then the S, sucralfate. This is the medication that's given on an empty stomach that coats the lining, and it prevents any further breakdown of the gastric lining and if the patient has ulcer disease. All right, I hope you learned something from this video. Follow, save, and share for more. You got this.